11 years ago, I had a mammogram on live TV. Shortly after, I was diagnosed with breast cancer. For anyone who's received a cancer diagnosis, it's surreal. My life changed in an instant. Since that defining moment, I've learned that breast cancer isn't just a chapter, it's a storyline that keeps unfolding. There's the diagnosis, the treatment, and then the quiet part, the part where you're expected to move along, but everything inside you has changed. That's why I'm here. I have vowed to do more, to use my platform to inform and to inspire more, to be more active, to embrace change. I'm partnering with Novartis to launch Voices of More, a space for real talk about living with breast cancer and everything that comes after. As your More respondent, I'll be sitting down with some courageous individuals who have been diagnosed with early or metastatic and are being treated by Kisqali to hear about their experiences, the heartbreak, the fortitude, and the moments in between, and give voice to the stories too often left untold. We've named this series Voices of More because that's what we all deserve. More conversation, more clarity, more community, and more truth. More than statistics, more than a diagnosis. Each episode will hear from women navigating life with either early stage and metastatic stage breast cancer. We'll tackle the tough topics from fear of recurrence, image, identity, relationships, and taking back control, because nothing should be left off the table. My goal? Ignite conversation and connection. Together, we will create a safe space where our stories come first, unapologetically, unashamed, and undeterred. Whether you're newly diagnosed, a few years out, or supporting someone you love, these stories are for you. Because the more we speak, the less alone we feel. And the more we share, the more we inspire. There is so much more to share. Stay tuned. To hear more voices of strength and fortitude, visit voicesofmore.com. And please see important safety information at the end of this video.
What is Kisqali? Kisqali ribociclib is a prescription medicine used to treat adults with hormone receptor HR-positive human epidermal growth factor receptor 2 HER2-negative breast cancer in combination with an aromatase inhibitor for stage 2 and 3 early breast cancer with a high risk of coming back. It has gotten worse or has spread to other parts of the body, advanced or metastatic breast cancer, in combination with an aromatase inhibitor as the first endocrine-based therapy, or fulvestrant as the first endocrine-based therapy, or following disease progression on endocrine therapy. It is not known if Kisqali is safe and effective in children. Important safety information. Kisqali may cause serious side effects, including lung problems. Kisqali may cause severe or life-threatening inflammation of the lungs during treatment that may lead to death. Tell your healthcare provider right away if you have any new or worsening symptoms, including trouble breathing or shortness of breath, cough with or without mucus, chest pain. Severe skin reactions. Tell your healthcare provider or get medical help right away if you get severe rash or rash that keeps getting worse, reddened skin, flu-like symptoms, skin pain or burning, blistering of the lips, eyes, or mouth, blisters on the skin or skin peeling, with or without fever. Heart rhythm problems, QT prolongation. Kisqali can cause a heart problem known as QT prolongation. This condition can cause an abnormal heartbeat and may lead to death. Your healthcare provider should check your heart and do blood tests before and during treatment with Kisqali. Tell your healthcare provider right away if you have a change in your heartbeat, a fast or irregular heartbeat, or if you feel dizzy or faint. Liver problems. Kisqali can cause serious liver problems. Your healthcare provider should do blood tests to check your liver before and during treatment with Kisqali. Tell your healthcare provider right away if you get any of the following signs and symptoms of liver problems. Yellowing of your skin or the whites of your eyes, jaundice. Dark or brown, tea-colored urine. Feeling very tired. Loss of appetite. Pain on the upper right side of your stomach area, abdomen. Bleeding or bruising more easily than normal. Low white blood cell counts, neutropenia. Low white blood cell counts are very common during treatment with Kisqali and may result in infections that may be severe. Your healthcare provider should check your white blood cell counts before and during treatment with Kisqali. Tell your healthcare provider right away if you have signs and symptoms of low white blood cell counts or infections, such as fever and chills. Your healthcare provider may tell you to decrease your dose, temporarily stop, or completely stop taking Kisqali if you develop certain serious side effects during treatment with Kisqali. What should I tell my healthcare provider before taking Kisqali? Before you take Kisqali, tell your healthcare provider if you have any heart problems, including heart failure, irregular heartbeats, and QT prolongation, have ever had a heart attack, have a slow heartbeat, bradycardia, have high blood pressure that is not controlled, have decreased thyroid gland function, hypothyroidism, have problems with the amount of potassium, calcium, phosphorus, or magnesium in your blood, have fever, chills, or any other signs or symptoms of infection, have liver problems, have kidney problems, are pregnant or plan to become pregnant. Kisqali can harm your unborn baby. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment with Kisqali. Females who are able to become pregnant and who take Kisqali should use effective birth control during treatment and for at least 3 weeks after the last dose of Kisqali. Talk to your healthcare provider about birth control methods that may be right for you during this time. If you become pregnant or think you are pregnant, tell your healthcare provider right away. Are breastfeeding or plan to breastfeed. It is not known if Kisqali passes into your breast milk. Do not breastfeed during treatment with Kisqali and for at least 3 weeks after the last dose of Kisqali. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Kisqali and other medicines may affect each other, causing side effects. Know the medicines you take. Keep a list of them to show your healthcare provider or pharmacist when you get a new medicine. What should I avoid while taking Kisqali? Avoid eating grapefruit and avoid drinking grapefruit juice during treatment with Kisqali, since these may increase the amount of Kisqali in your blood. The most common side effects of Kisqali in people with early breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, increased kidney function test, decreased platelet counts, nausea, headache, tiredness. The most common side effects of Kisqali in people with advanced or metastatic breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, nausea, increased kidney function test, tiredness, decreased platelet counts, diarrhea, vomiting, headache, constipation, hair loss, cough, rash, back pain, low blood sugar level. Kisqali may cause fertility problems in males, which may affect your ability to father a child. Talk to your healthcare provider if this is a concern for you. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Kisqali. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including patient information, at Kisqali.com.